Hi, I'm Dr. Ted Rietsma from Mavis Road Animal Clinic. Today we're going to talk about heartworm. Did you know April is Heartworm Awareness Month? Did you know cats can get heartworm as well? And did you know for cats there is no treatment for heartworm? Heartworm is a dangerous and potentially fatal disease that dogs can get. Unfortunately, there are millions of dogs that are not on heartworm preventative, and 1/3 of dogs that are on heartworm preventative are not giving it their, monthly as they should be, so they're not potentially protected. Heartworm can actually grow up to 14 inches long in your animal's heart. It can take years before you show any signs of damage at all, and unfortunately at that point a lot of damage may have been done. It can damage the heart, it can damage the kidneys, it can damage the lungs, and it can damage the liver. And it's from clots that have formed and heartworm larvae that may have clogged up everything. Heartworm is transmitted by mosquitoes who have already bitten another infected dog. In fact, the heartworm from the dog has to replicate in the mosquito to a different stage in order for it to infect your dog. So your dog is exposed when there are mosquitoes in the area and other dogs in the area. That's how the life cycle works. The signs of heartworm that we would see often are, well, sometimes actually can be sudden death, which is not very helpful, but often are being tired, developing a cough. Signs are very, very similar to actually heart disease, and one of the things that we think about when we see heart disease is it due to underlying heartworm as an infection. So if your dog is infected, how do you treat it? Well, there is treatments out there. Unfortunately, they are somewhat dangerous. The treatment up to a couple of years ago was injecting an arsenic-type compound into your pet to kill the heartworm. It wasn't 100% effective. It was potentially very, very dangerous. Now we have a much better product. It's much safer. Saying that, at best, it is 89% effective. It's somewhat expensive. Your animal has to be strict rest for several weeks after the medication is given, because the dead heartworms can lodge into different body parts based in the bloodstream. So again, even though we have a better treatment, it's very, very dangerous. How do we avoid this? Well, fortunately, although the treatment is only 89% effective at best, prevention is 99.9% effective. There are many, many effective products out there for heartworm disease. There are many, many very effective heartworm preventative products. Some of them are chewable products that are given once a month. Some of them are on the neck, and they cover various items as well, such as they prevent fleas, they also prevent ticks, they prevent ear mites, and they prevent certain types of mites, like sarcoptic or Demodex mites as well, and several different gastrointestinal parasites. So which one is right for you? And it's best to discuss that with your veterinarian. Some of these products can't be given for collies or herding dogs, for instance. Some of these products can cause temporary rashes on some animals. So everybody's different, and what's in your area is also a factor. So your veterinarian is the best one to help you decide what's the best product for you. So if your animal is under 6 months of age, we normally just put them on a preventative medication. If your animal is over 6 months of age, we do a heartworm test to make sure they do not have heartworm yet, and that way we can safely put them on and know that we're preventing a heartworm infection. The Heartworm Society recommends testing every year. We make that an option, not a requirement, but they have to have it tested at least once or start the medication properly early on in their age, less than 6 months of age. Again, it's best to test yearly as a most effective tool, because people do not always give their medication on time like they're supposed to. So I hope this was useful information for you. This is Dr. Ted Rietsma from Mavis Road Animal Clinic. Thank you.